Adolescence is a critical juncture in the adoption of behaviors that are relevant to health. Many of the behaviors that are linked to poor health habits and early death in adults begin during adolescence. In adolescence, many individuals reach a level of health, strength, and energy that will never match during the remainder of their lives. During this high level of physical strength, good health, and high energy, it is not surprising that many adolescents develop poor health habits. Increasingly, experts recognize that whether or not adolescents develop health problems depends primarily on their behavior. These experts' goals are to reduce adolescents' health-compromising behaviors and to increase adolescents' health-enhancing behaviors. Some examples of health-compromising behaviors are drug abuse, violence, unprotected sexual intercourse, and dangerous driving. And some examples of health-enhancing behaviors are exercising, eating nutritiously, wearing seatbelts, and getting adequate sleep. Risk-taking behavior. One type of health-compromising behavior that increases in adolescence is risk-taking. A recent study revealed that sensation-seeking increased from 10 to 15 years of age and then declined or remained stable through the remainder of adolescence and into early adulthood. Of course, not all adolescents are high-risk takers and sensation seekers. Researchers have also found that the more resources there are in the community, such as youth activities and adults as role models, the less likely adolescents are to engage in risky behavior. It is also important for parents, teachers, mentors, and other responsible adults to effectively monitor adolescents' behavior. In many cases, adults decrease their monitoring of adolescents too early. Health services. Adolescents underutilize health care systems. Many adolescents don't believe that healthcare providers can help them. Professional guidelines for adolescents recommend annual preventative visits with screening and guidance for health-related behaviors. Only 38% of adolescents had a preventative visit in the previous 12 months. Of special concern is the low use of health services by older adolescent males. Adolescents were much more likely to seek health care for problems related to disease than problems related to mental health, tobacco use, or sexual behavior. Among the chief barriers to better health care for adolescents are cost, poor organization and availability of health services, lack of confidentiality, and reluctance on the part of the health care providers to communicate with adolescents about sensitive health issues. Leading causes of death. The three leading causes of death in adolescents and emerging adults are accidents, homicide, and suicide. Almost half of all deaths from 15 to 24 years of age are due to unintentional injuries, approximately 3/4 of them including motor vehicle accidents. Risky driving habits may be more important contributors to these accidents than lack of driving experience. Homicide is the second leading cause of death in adolescents and emerging adults, especially among African American males, who are 3 times more likely to be killed by guns than natural causes. Suicide is the third leading cause. Since the 1950s, the adolescent and emerging adult suicide rate has tripled, although it has declined in recent years. Emerging adults' health. Emerging adults have more than twice the mortality rate of adolescents. Compared to adolescents, emerging adults engage in more health-compromising behaviors, have more chronic health problems, are more likely to be obese, and are more likely to have a mental health disorder. Emerging adults may know what it takes to be healthy, but they often don't apply this information to their own behavior, therefore making them not as healthy as they seem. Young adults can draw on physical resources for a great deal of pleasure, often bouncing back easily from physical stress and abuse. However, this behavior can lead them to push their bodies too far. The negative effects of abusing one's body might not show up in emerging adulthood, but will surface later on in life.